The effects of electrical stimulation of chronic wound healing. Definition. Electrical stimulation can be used in the treatment and management of chronic wounds. Science is often advised effective and efficient wound management. Current recommendations, according to FDA, for the use of this therapy are in crowd circulation and discrete edema. Different types of electrical current can be used for wound healing: low intensity, direct current, transcutaneous electrical nervous stimulation, TENS, and high voltage pulse current. It is appropriate to treat ulcers with electrostimulation 3 to 7 times a week.
Hi there, I'm Darren Sorensen. I'm a student at Elon University for physical therapy. Today I'm talking to you about high voltage pulse current electrical stimulation to treat chronic wounds. In a study by Pollock et al. Titled High Voltage Pulse Current Electrical Stimulation and Wound Treatment, they used HVPC treatment for stage 2, 3, 4, and 4 pressure ulcers, as well as for chronic leg ulcers including venous lesions. Under the time frame that they use and the parameters that involve that we'll talk about in a little bit, they found significant wound closure after measuring wound size after 4 weeks. One study was followed up to full wound closure, but the rest had significant wound closure that correlated with full recovery from these lesions. So going through some of the parameters that they followed, this study was actually a correlation of several studies, and they found that the best parameters to follow was a pulse duration of around 100 microseconds, voltage anywhere from 50 to 200 volts, with the intensity being emphasized to be at the sensory level and not having any motor activation. The frequency was usually around 100 to 105 pulses per second, and each treatment session was roughly 60 minutes, 5 to 7 times a week. It was noted that in only 45 minutes of treatment, you could have significant wound closure in just that amount of time as well. So looking at the placement here, we have a nice ulcer here on my patient's leg, drawn with a blue marker. So for the first placement is directly within the wound bed, and the second electrode placement is 15 to 20 centimeters away from the treatment electrode in healthy, viable tissue. And in the studies that they researched, they found that using a negative electrode as a treatment provided the best results, and then a positive electrode on the healthy, viable tissue. So after performing these parameters, running the electrical stimulation for 45 to 60 minutes, there should be positive results after 4 weeks of treatment.
Application in physical therapy. Physiotherapy uses electrostimulation for chronic wounds, which is clinically incident in pressure ulcers categories 2, 3, and 4, venous, arterial, neuropathic ulcers, surgical wounds that do not heal, and traumatic wounds. Contraindication in basal or squamous cell carcinoma in the ulcer or precision tissue, melanomas, and osteomyelitis. Electrostimulation has a great therapy effect The affectation of the patient and his board racket must be considered to determine the best treatment.
This might sound like something from a charlatan in Victorian-era medicine, but electricity can help heal your wounds, y'all. Hey everyone, I'm Trace. Thanks for tuning in to D News. That's what I said. Electricity can help heal wounds, and not in the androids of the future, or the Borg, or something, but right here, plain old meat bags. In 1791, Italian physician and philosopher Luigi Galvani took a dead frog and used small amounts of electricity to cause the frog's leg to twitch. He discovered muscles move with electrical contraction. Then in 1843, German physician Émile Dubois-Reymond founded the field of electrophysiology, the idea that the human body and other animal bodies have their own electrical properties. And since then, we've learned how animals have this web of electrical transmission lines extending throughout our systems into every nook and cranny of our bodies. More recently, scientists learned under the skin is a faint electrically ionized field running parallel to the surface at around 100 millivolts, and though you can't sense it, your cells can. When the body is wounded, the current changes course, running perpendicular to the skin instead of parallel. This is like an air raid siren for the cells of the body, signaling that the flesh needs help from the body's healers, platelets, white blood cells, proteins, you know. At the University of Aberdeen, researchers used very low-level electrical fields to help wounds heal and flesh regenerate 50% faster than letting it go on its own. The problem was, it was documented 150 years ago by Émile Dubois-Reymond. Over 150 years after these researchers discovered these electrical fields, Stanford scientists found that animal cells use these electrical fields to usher the repairman of the body toward a wound and the innocent bystander cells away from the danger zone. Danger zone! The cells rushing toward the wound have two little markers on them. One is pointing them toward the wound, like a compass that always knows where to go. The other is blocking out other electrical signals. This is kind of like a siren on an ambulance, but even better, and on a microscopic level. It's sort of similar. The cool thing is, even now, after hundreds of years of science, there is still a lot more stuff to find out about the inner workings of our body. Armed with this new knowledge, doctors may be able to develop bandages that use small electrical fields to draw healing cells to desired parts of the body and drive away those cells that they don't want to interfere with the healing process. They could also speed up tissue repair and regeneration, all with just a few millivolts. Have you ever been shocked? I mean, I stuck my fingers in an electrical socket when I was a kid, but there must be some crazy electricity stories out there. Share them with us. Post them on our Facebook or Google Plus pages, tweet them at us at DNews, or leave them in the comments. Thanks for tuning in, everyone. I'm Trace. This is D News. We'll be seeing you.
Pros and cons. Pros. Promote wound healing in acute and chronic states. Active the healing process. Cellular electrolytations of macrophages, neutrophils, and fibroblasts in the wound also promote healing, improves protein and collagen synthesis and ATP and DNA production, promotes the growth of granulation tissue. Cons: may cause burns, do not use pines with cardiac pacemakers. It will be used according to area of extension of the affected tissues because it could make the pain worse. Treatments need 7 days or more.
Muscle fibers are under voluntary control exerted by the brain via the motor neurons. Damaged muscle fibers cannot react as effectively as healthy fibers. This can be seen in cross-section. The fibers of healthy muscles are thicker than those of atrophied or non-innervated muscles. Their basic electric charge is also different. The charge is much lower in non-innervated muscles. If muscles are not used, they atrophy rapidly. The muscle's mass and its function are both reduced. Muscle fibers that lack innervation do not possess the necessary basic electric charge. They need to be charged up before they can react to incoming electrical signals. This means that healthy, atrophied or paretic muscles can be activated by the appropriate electrical signals. Neuromuscular electrical stimulation, NMES for short, can strengthen weak muscles using microcurrents. Neuromuscular electrical stimulation uses microcurrent stimuli delivered to the skin to stimulate muscles to contract. With NMES, the contraction is involuntary. In other words, it is caused without the involvement of the CNS. The contraction results directly from the electrode's effect on the innervating nerves or the muscle fiber itself. This means that NMES can be used successfully in rehabilitation after paralysis, before and after operations, and also preventively.
Conclusion. The management of electroimmunization therapy should be inside for wounds that are difficult managed after the use of other therapies that have not results. Low stimulation therapy works and has been demonstration in effect study. It turns to have complication application, but in primary care and specialization wound units. Thank you.